The next presenter is Dr. Arun Zachariah.
Oh, Arun
Dr.
Zachariah.
Zachariah is a Chief Forest Veterinary Officer from Kerala State in India. Since 1994, Dr. Zachariah has been working as a wildlife veterinarian for the government of Kerala with both the Department of Animal Husbandry as well as the Department of Forest and Wildlife. Dr. Zachariah is experienced in disease surveillance and epidemiological studies in free-ranging wildlife, as well as in laboratory techniques that aid in disease diagnosis, including molecular diagnostic methods in infectious disease of veterinary importance. Dr. Zachariah's presentation will be about disease ecology and emerging diseases in free-ranging Asian elephants. So, Dr. Arun?
Thank you, Heidi.
Please start whenever.
Am I audible?
Yes, you are.
Okay, let me share. So, okay, can you see the slide?
Yes.
Okay, so thank you very much. Thanks a lot meeting all and sharing some of our experiences. And okay, so this is the topic given to me, disease ecology and emerging diseases in free-ranging Asian elephants. So I'm working as a forest veterinary officer with the forest department for the last 22 years. So we just want to sum up some of our findings and what you were seeing in the field. So basically, I'm working with free-ranging wildlife. So whatever we are covering with the free-ranging wildlife mostly. Okay, so looking to our topic, we got around 350 species of proboscideans. Only two genera now survives or exist. Rest of them are extant. Like you can have Dinotheriums, Mastodons, Gomphotherium, and so many of them became extinct. And looked like in Paleoloxodon, the huge elephants to pygmy mammoths. So what would be the reason for this extinction, this mass herbivore extinctions? So one hypothesis that put early, 50 years back, was a hyperdisease concept. Okay, so hyperdisease is just like a pandemic really causes extinction. And one of the example is given by Rothschild and Loeb in 2006. They identified lots of MTB lesions or tuberculosis lesion in the fossils of mastodons, especially American mastodons. So they said, okay, TB is invaded through human migration into North America or all across America and caused the extinctions of many herbivores, especially American mastodons. So this is quite interesting. Actually, it's not nobody noticed this paper much, but this gives an indication. Of course, disease has a role in cause of extinction in many of the species, especially larger herbivores. Okay, so as you know, in the Asian elephants, and this is the distribution of Asian elephants, you can see mainly seen in 13 countries and the largest population in India. So current problems in elephant conservations are, it's mainly due to high density, due to habitat degradation and fragmentation, and that compromise with the home range requirement. So actually this pushes the elephants into, in thick groups, and which create a lot of issues. And second, due to extensive large poaching and this habitat fragmentation, genetic variability is coming down in elephants in many populations. And there is a high level of man-elephant conflict, as Christopher told, especially in Sumatra and part of India also, and which threats the conservation. And there is a highly skewed male-female ratios. And in some of the places in India, the male-female ratio is 1:200, and which impairs lots of selection process, including sexual selection process. Then there is a cattle grazing problem, the landscape being used by so many other purposes, including agriculture, animal husbandry practices. And of course, emerging infectious diseases are identified as a new threat. And the real problem is actually we don't have many previous research on mortality or morbidity due to diseases in elephants. Hardly I couldn't say one or two PhD theses and very limited papers. So looking into the paper number, I would say 98% of papers are based upon the captive elephants. Only 2% of papers are based on free-ranging wildlife. So very limited data is available. So Asian elephants are quite unique, the longevity, just like a human being. Most of them live up to 70 years and up to 80 in captivity, and mostly in 60 to 70 if they are survive in the wild. And puberty and age of sexual maturity is almost just like in human, 13, 14 years, they become in 10, 12, they become attain the puberty, and by 13 they attain the age of sexual maturity, just like in human being. And the social organization is quite important. It's a matriarchal society, the lead female, and she decides the survival of the herd. And the sexual dimorphism and the sexual selection, which is quite interesting. Not like in African counterpart, we have a sexual dimorphism. The bulls have tusk and females have, most of the time, they don't have tusk, or they may have small tushes. And there's a huge sexual selection is happening, okay, which is quite important in Asian elephants because females are selecting best bulls. There will be a male-to-male competition during the must season and female selecting because she's investing the energy. And the behavior is quite interesting in elephants. There's a changing in behavior pattern looking into human-wildlife conflict. Now we are facing with large number of huge bull congregations creating conflict, and the natality and mortality. Okay. So the problem with us working in free-ranging wildlife, especially in elephants, how would we monitor the health in the wild elephants, and how we could say how fit or how healthier our wild elephants are? First, we can look into body index, look into the body. There are body index parameters. There are a lot of references you can look into. And we can look into the body index and we can say, okay, this body index is very low. And we can say the animal, the herd is not healthy or our population is not healthy. If it is in the captive situation, always you can have a clinical examination like Christopher told, you can go for pulse, respiration, temperature, blood picture, serum biochemistry, everything to look into. And you can come to a condition of the health status. And in the free ranging, you can go for non-invasive sampling also. You can collect the dung and urine sample if you are lucky enough to get it fresh. And look into the disease conditions in those samples and come to an epidemiological picture. Okay, then finally, and looking into morbidity and mortality in the population and to identify the health in the wild elephants, and which is a more practical, this approach we are doing postmortems. So far, we did more than 620 postmortems in elephants. And so we will get a clean picture of what's really happening because you're looking, every postmortem is quite important. You're opening a carcass and you're seeing the real lesions if you're lucky enough, if it is not putrefied. Okay, looking at the body index. See, this is a situation in summer in my landscape. See the body condition. You can see the dipping of shoulders. You can see the ribs. And the all indexes are very negative. And you can say this population is unhealthy. You can imagine. But when the rain comes, the whole situation changes. So body index cannot be used in most of the situation because if the population depends on seasons availability, elephants tend to change browse and grays depend on the season. If it is an evergreen, okay, you can count on body index. But if the seasonal changes happens, elephants tend to browse and graze changes, and definitely there will be changes in body indexes, and which cannot be used as a legitimate index to identify the health condition. Okay, then regarding the non-sampling, I'm not talking about, I mean, the captive situation. So non-invasive sampling, as I told, urine, or you can get fecal sample fresh from the wild. So the problem is that many of the time, the pathogens are not shed through either feces or urine. Okay, and sometimes especially like viruses are very fragile. Okay, we try to identify herpes virus in fecal samples and our success rate is very, very low. But we know that the animal is affected with the herpes virus because the virus is not stable at all. So it may not work in most of highly fragile pathogen, especially viruses. Then good for assessing prevalence of internal parasite. Definitely you can use it. That is the best way to do it. And problem is that difficult to correlate with the interpret epidemiological data derived, because if you are not identifying the population size and age structure, you cannot come into an epidemiological data. To identify the age and sex from the non-invasive sample is very difficult and time consuming and costly as well. So it's very difficult to correlate to come into an epidemiological data. And finally, it left with the mortality in Asian elephant. This is not a clean, good this thing. The mortality in Asian elephants, it fluctuates. It just not like in a single plethora, like in the human being. In the human beings, you can expect a percentage of mortality in some seasons. Okay, but it's almost like a study. But when you look into elephants, it fluctuates. Every 4 years, you are getting a fluctuations of mortality, and which is quite interesting. And there are so many variables you can correlate, especially the climate change also you can correlate. And season-wise also, especially I told you, elephants which are depending on the seasons, there will be more changes of mortality during the season. For example, in our population, we are having high mortality during summer season, another peak during September, October, November, December season. And those two also, when you correlate, you can find the summer mortality is much more to old elephants and young elephants. And the October, November mortality is mainly in prime bulls, mainly due to fight or other kind of breeding problems. Okay, so there are a lot of dilemma in veterinary profession in care of free-ranging wildlife. Okay, the problem is, should we have to look into individual or into populations? As I told you, when you look into the papers, you can find more of the case reports rather than epidemiological population data, which is quite, you cannot interpret those things. So should we have to focus on individual or should we have to focus on the population wise? And second question is, should we have to focus on welfare or the conservation? Most of the concept is based upon the welfare because most of the science derived from captive elephants, which is based on welfare. So people used to confuse, veterinarians used to confuse, should we have to focus on welfare or go to conservation? And third important is the unique evolution of Asian elephants. It's an Afrothetan species. Okay, it's actually evolved in northeastern Africa and came to Asia. Okay, so their evolutionary thing is entirely different. And most of the pathogens, especially the internal parasites, are unique for elephants. You cannot find much of parasites from other species, just like you cannot find internal parasite of a gore or sambadia in elephants. Then the fourth one, again, I told the lack of knowledge or information of disease ecology of free-ranging wild elephants, so wild animals, basically. So we are clearly deprived of data. So conceptual inabilities. This is another problem. So people used to, especially veterinarians who trained, because we are not trained in wildlife, in captive situations, we think disease is a negative point. But most of the conditions, I would say, in the population wilds or in the free-ranging situation, disease as a major natural selection process. I will explain that later. Then coming to that, defining the level of intervention, where and when to be intervened. Should we have to intervene? That is a question in a population. Okay, if there is a death due to a herpes virus, should we have to intervene? Should we have to vaccinate all the animals? And those kind of questions. So I used to get questions from the people asking, why can't we develop oral vaccines for many diseases like that? So the question is, should we have to intervene? That's a dilemma. So these are the main dilemma what we are facing as a veterinarian in the case of free-ranging wild elephants. And coming to example of this thing, parasitism versus predation. Okay, so this is the right one. You can find an elephant calf killed by a tiger. You know, the tiger is a major predator of elephants, especially in the young animals, not an adult one. So we analyzed around 132 cases of these kind of predations, and we found that all of them, 92% of them, had infected huge parasitic load. Okay, so it is called parasitic mediated predation. this parasite is actually mediated predation. So this is a selection process is happening. Parasite mediates that reduces the fitness of the animal, which lead to predation and the selection process happening. So kind of that conceptual problems exist. So when this all coming to in the free ranging situation, we have to consider the disease in a multidimensional view. You have to look into an agent as a host and the environment, and not like in a captive situation where we may mainly look into the agent. What is the disease really causing? What is the pathogen really inflicting the disease? But in a free-ranging situation, you have to look into the agent, the host, maybe the genetics, immunity, and other ecological parameters. And the third is the environment, which is quite important nowadays. Okay, so my presentation focus on these 3 points. Okay, so the changes in any of these will change the triad and the disease epidemiology. Okay, so that gives us the concept of One Health. Okay, so looking into a free-ranging elephant situation, always we should have a wildlife disease ecology. So wildlife disease ecology is simply defined how do climate, evolution, and free living hosts interact to determine the dynamics of pathogen and burden of diseases. So Hudson actually defined it in 2002. It's a wildlife disease ecology defined as an ecological study of host pathogen interaction within the context of the environment, as a triad I mentioned earlier. So it's better to have a disease ecology aspect. The wildlife disease ecology is something a new science, very nascent science. And looking into wildlife disease situation always should have a disease ecological perspective. Okay, so I will just simply explain some of the mortality, cause of mortality. So I told you the predation, natural causes, which are happening naturally in a population. Sometimes the elephant can fall, right? So our predation rate is around 9 to 10% in elephants, because the young animals are killed by tigers, mainly by tigers. Then sometimes they can fall, they can slip and fall. And for example, in this case, you can find a healthy animal. You cannot find much problems, no fractures, nothing, but just the animal is stripped with a small vine and it broke. It just gone into the mud and it's broke its atlanto-occipital joint. So animal can fall and die. And there are other causes. They can fight, huge fight incidents happening. Okay, our bull mortality rate is around 10%. Okay, in the largest global population, that is the NBR, Nilgiri bear sort of population, they can fight male-to-male competition, especially during November, December, when there is a musk condition. They come, they do fight, and they kill each other. And for example, in this case, it's quite interesting. That has happened in Periyar Tiger Reserve 10 years back. A single bull killed 22 females. Okay, usually it's very quite rare, bulls killing females. So these aberrant things can also happen. Then coming to anthropogenic reasons, man-made issues, mainly killing for ivory, luckily, which is came down quite less because of intense activity of the forest department. And sometimes due to natural electrocutions. Okay, lightning can cause. The left one is a lightning case. It killed, wiped up the whole herd. And right side is a electrocution due to a man-made. There is a high power line. Sometimes some are due, they may slag. So they may touch and they can kill. So there is a both natural and by accidents. And these are electrocution accidents. People used to put electric lines for bushmeat, for killing wild boars or deers. Sometimes elephant got electrocuted in that. Sometimes they do poisoning. This is mainly to mitigate human-wildlife conflict. That's exactly Christopher told earlier. So sometimes if it is an animal come to conflict, they do poison. Okay, they dies. Sometimes they put country bombs, that explosives hidden in a jackfruit or maybe pineapple, so can cause death. And there are other non-infectious diseases as well, like parasitic diseases, which can be infectious and endemic also. But at the same time, we find a lot of cases of peritonitis, okay, in elephants, mainly due to penetration wounds, especially bullets or other kind of things. So looking into disease, and we can basically classify based upon etiology and or epidemiological pattern. Based upon etiology, you can classify as microparasites and macroparasites. Okay, and the epidemiological, microparasites are just viruses. You can see them, bacteria, all kind of things. And macroparasites are mainly helminths, trematodes, those kind of things, cestodes. And epidemiologically, you can define them. There are some diseases inherent to diseases that are diseases evolved along with the elephants. I will give you some examples. And so there are some other diseases affecting multiple taxa. The dynamics is different. They can affect a goat, a boar, sometimes a cattle. Okay, and comes the emerging diseases. For example, in this interesting case, there's a stomach of an elephant. You can find boards, okay, in the stomach, which is very common. 90% of elephants, you can find these boards. These are boards of a larvae of a fly called cobaldi elephants. Okay, they lay eggs on the commissures of the mouth or maybe around the tusk, and elephant swallow it. It hatch in the stomach, and larvae pupate, and the pupa breaks, and the fly through the mouth. Okay, this is the only place in the world this particular fly can survive in the world. Okay, only in the elephant stomach. Okay, this is called coevolution. This fly is evolved with the elephants. Okay, the elephant dies, fly gone. So there are some diseases which evolved along with the elephants. For example, another one, in the case of this is an elephant calf. This around 60% of our elephant calves dying because of it's called Grammocephalus species, viridatus, or Grammocephalus species, viridatus, and which are large hookworms affecting liver. This only pathogen you can find. This is a major 60% of mortality in elephant calves because of it in the free range wildlife. So, but they can kill the animal also. Okay, this is what is called density-dependent selection. Okay, when the population increases, these parasites actually controlling the population, and this is one of the major selection process. Okay, so all right. Okay, this is the case of an anthrax. I would say there are some diseases which can affect multiple taxa. So they can kill an elephant, and they can kill the wild boar. Right, they say wild boar, pigs are resistant with anthrax. No, there are lots of anthrax cases in wild boar. They can kill. So they're basically from the soil. The spores they're getting the soil. Their dynamics are entirely different. Then coming to emerging infectious diseases, so which is quite interesting because we've identified a lot of emerging infectious diseases coming up in Asian elephants. So this is a definition by the most those diseases which have appeared in a population for the first time, or those diseases which have existed but are rapidly increasing the prevalence or geological area. So there are lots of emerging infectious diseases. There are wildlife EIDs, there are human EIDs, there are domestic EIDs, which intervening, okay, which are connected. Okay, they are called interface. There are interfaces. They are connecting, and there is a transmission of emerging infectious diseases like hantaviruses in humans or equines. They're getting from the bats. Okay, these are spillover events, otherwise called spillover. There are so many drivers for that global travel, human encroachment, translocation, environmental changes, agriculture, the same practices, technology practices. There are so many drivers for them, but these are the major EIDs which can be classified separately. So we are working in the wildlife EID. For example, in the case of this an elephant killed by a parasite called Parabronema smithii, a small worm, which affects the young animals, causing tumors in the stomach, and subadult animals, causing nodules in the intestine, which prevents them absorption. Animal dies. And usually we didn't get much of the cases. Now the prevalence is very high. So primarily we can say, I'm not saying it's a new disease, but I would say the prevalence is increasing, which can consider it as a emerging disease. So primarily we think it is mainly due to contagion of elephants due to habitat loss. They push to in some places, so the transmission, the orophycal contamination is the route of transmission, and they get infections through that way. Then coming to spillover, the tuberculosis in elephants, this is a major problem in captive elephants, especially in European and American zoos, and definitely in captive situation in Asian conditions also, but not much in studies gone through it. So elephants are very prone to Mycobacterium tuberculosis, MTP. MTP is a human TB, evolved in the humans. Okay, as I told you, the hyper disease concept, which kills the mastodon. hypothetically kill the mastodon. Like the same thing happening. They get the infection from human beings. MTB is a human pathogen. Okay. And there are lots of these things. So we did a lot of postmortems. Then we got around 8 cases of MTB. So first, we are getting any kind of tubercle lesions. I will show you that. We do the impression smear and do the staining, acid-fast staining. We do the culture, very difficult to culture. We do the histopathology, but best thing is molecular methods, PCR and sequencing analysis for the species identification and typing. Okay, this is our first case of index in 2007. A young bull, around 20 years in wild, okay, died. You can find the body condition is very poor, and these are the massive lesions. You can see that these are left side is the mesenteric lymph nodes, and right side you can find the tubercle. Okay, right. The same thing happening in the mediastinal lymph node, large lymph node with mucopurulin, and the right side is the lung condition, massively infected with the mucopurulin changes. When you do the histopathology, you can find clear tubercle nodules, right? Then you can identify the TB in acid-fast, histopathology, acid-fast, you can find impression smears also. So our cases, the mortality percentage is 6%, which is old data. Right now we have 8. Then MTB 4.7%. Only males affected, which is also wrong. We got recently a female case, and age group between 15 and 40 years. Okay, young animals are not being affected, but mainly adult animals. So significance of conservation. So we think this is so the first we got all of the 5 cases, we got it from bull elephants, which did the conflict. Okay, we thought so they pick up the infection. Otherwise, elephants, nobody can sneeze into, the transmission of TB is very difficult. It should be a 10 micron like droplets has to transmit it. Okay, if I should get a TB patient should sneeze and I should inhale that droplet. But it's not possible. So a TB patient can catch hold of a wild elephant's trunk and sneeze into it. But the problem with that, first we identified with the captive elephants, but now we get a female elephants that is indicating it is circulating in the wild. Okay, so because females are not conflicting, very rarely conflicting in our landscape. So it is circulating in the herd, which is not a good news for us. Then pathogen spillover from the human being was the cause of emergence of Mycobacterium tuberculosis. So behavior may have a role because coming to human settlements, tourism, especially may be predisposing the conditions. Then coming to emergence of viral diseases, the EHV, I don't want to talk about much about it, the history of EHV. So we reported EHV first in 2007, the first case from the wild. Then we got around 46 cases of TB so far. And these are our captive TB cases. All of them are orphan calves. We put them in captivity because they are orphan. And many of them dies. Sometimes they transmit. And these are some of the wild cases. This old data, actually 22 cases, more than that now. So the middle one was the Intex case. Mother was guarding. The calf is alive, but died within a few hours. Okay, so I just want to show some of the lesions because you know it better. So, but that's a peracute onset, there will be temperature, anorexia, dullness, and facial edema, sinus of the tongue. And there is extensive pathological lesions, extensive hemorrhagic lesions. And this is the facial edema you can see. Okay, you can see around the periorbital area, there should be edema, facial edema is there. And the tongue would be very bluish in color. First, you can find the salivation, then the tongue would be very bluish in color, clear cyanosis. And when you do the pathology, you can massive hemorrhagic lesions, just like epicardial lesions, massive lesions, and massive endocardial lesions involves, and the peritoneal lesions as well. Then the liver would be just like a balloon, okay, and you can appreciate the subcapsular lesions also, hemorrhages also. And you can find the lesions in the brain. There will be dullness and behavioral changes as well. So you can find mainly you can find the inclusion bodies in the liver or heart. But the best way to do is PCR. And these are the target genes we are using. So these are some PCR. And the story, actually, the herpes viral, as you know very well, first it thought as a species gem from African elephant to Asian elephants in zoos, but we identified first gem in wild. It was a surprising. Then basically it's a beta herpes virus forming a new proboscis group. Okay, uh, so it's finally when we did the sequencing, we did around this 46 cases of sequencing, and we identified that from our landscape is also, it's actually co-evolved with the species. Okay, so the transmission is mainly through individual to individual close contact, mainly through secretions, trunk wash, because the main identification method is trunk wash. Adults are carriers. Okay, so these are cases we identified in the wild. We got the first case and we tracked that herd for almost for 3 months on foot, and we got a second animal. Then we did the sequencing, whole viral sequencing, we exactly the same virus. Okay, so the molecular epidemiology is interesting. We added 31 different EHV1A genotype. Okay, I would say strain. I can't say strain, but genotype. Subtypes were identified, which is quite variable. Each population have its own genetic genotype. So Christoph has a different genotype, and Assam, they have a different genotype, definitely. When you look into hypervariable regions, it depends upon which region looking into. So go for very hyper variable regions you can identify. There are 13 novel strains were identified. And quite interestingly, and there is no spatial or temporal epidemiological correlations, but sometimes they are much more seen during winter season, not winter for us, cold season, November, December, Jan. This is season. This month itself, I got 5 cases of herpes virus. So, but mainly during the weaning season, when they wean, so we are getting more cases that in that group. So that age group of 4 to 5 years of at the time of weaning, we are getting more herpes, not in the young calves. Young calves we are getting when we are getting the orphan calves. We are very young animals. We are getting herpes viruses. But in the wild, when you look into those cases, you can find most of them are juveniles, which are undergoing the process of weaning. So yeah, so the transmissions, then viral shedding. So as you know, our first work we did identified viral shedding in adult animals. It's the same work what they did in US. We did that, and we identified so many of animals are adult animals are shedding. They won't have any kind of clinical symptoms. So we tried the same thing in the wild. So we identified so many elephants. Actually, 2 elephants shed. That is wrong. Actually, there are 6 elephants so far we identified. When this opportunistic samples, when we did any kind of radio collaring operations, we collect the samples. We identified many females and bulls shedding viruses. So literally, I would say most of the elephant calves are born are under the shower of herpes virus in the natural situations. Okay, so why is some of that dying but some of that not dying is quite interesting. So on the context, there are so many hypotheses. One group is saying it's due to colostrum deprivation, like I said previously. Some group is say, the herd transmissions when the herd moves in, and likewise. And the group like we say there are host genotype actually deciding the mortality. So on the context of this, whether we can say it's a truly emerging or co-evolved with the species? Definitely EHV is co-evolved. It's not a true emergence. But the problem is that the intensity of the cases is really increasing. Okay, because our predecessors, Krishnamurthy, he did a lot of postmortems. He got only 1 case, but now we are getting a lot of cases. In 2007, we started. Now we got cases from whole across, Dr. Bhaskar knows, whole across India. We got cases from Myanmar, then Indonesia, then Sri Lanka. So wherever there are natural population, we are identifying herpes virus. So why it is increasing? Prevalence is increasing. There should be biases. We are looking into herpes virus. That's why there is one argument. There's one argument, but I cannot agree with that, because we are doing intensively postmortems, and why there is a real increase in spatial and temporal increase in incidence of herpes viruses. In that context, we can say it's emerging. Okay, we need more data to prove that. But whatever the impact, if it is emerging in such a situation, this is it's a survival 1x curve, mainly in elephants, just like in humans. It says that animals die as age goes on. Okay, young animals are not prone to death, death easily, but as age goes on, animal dies. So it's affecting mainly the early, the curve, and which can skew the curve and really causing the extinctions. So like small populations like in Indonesia and other part, we are quite worrying it can really cause extinctions. If it is a meta population, we are facing same thing in some place in Munnar. So one of my colleagues is there, he knows this better. So that area, there are a lot of cases identifying in that small population. Okay, so it's a meta population. There is a chance of extinction of those meta populations, not a large scale extinction. The place where I'm working, the NBR, around 9,000 elephants. So, but can cause extinction in isolated small populations. Okay, this is the hypothesis we want to put forward. EHV1 may have significant role in the Asian elephant population, could be emerging in the population. The loss of genetic variability, that is exactly we are focusing, like including the MHC1 variability, may have a direct relationship to the emergence of the disease. So this is sometimes a host genotype, what we are hypothesizing, may have a role. Okay, when there is an inbreeding happening, there is a high chance for the emergence. So since most of the herpes virus have latent infections or environment changes and the stress in the population might have a direct relation to the emergence. Now we are coming to the environmental changes. So first I talk about a spillover, a pathogen change from the TB. Then I said the host changes, genotype changes. And now I would say a change in the environment. This is a case actually, we identified per acute mortality in 2014 to 2017. This is a small landscape number, but sudden death. Animal is dying just like a dropped apple. So only adult animals, no female, no male bias is there. Dead due to summer seasons and grossly very difficult to identify from anthrax. They bloats like anything. Okay, within hours they bloats like anything. And no other significant mortality in cohabiting species, just like other herbivores, just like deers or bison. Okay, then finally we got one case, fresh case. The mother is alive, well, mother is dying and the calf is alive. And we got the fresh samples, and these are the pathological lesions, just like anthrax. In the beginning time, we were really hesitant because we got anthracoid-like organisms from the blood oozing out from the rectum, natural orifices. Then we did the spore PCR of anthrax, but it was negative. So we start doing the postmortems. And it just like the pathological lesions are, they're just like, typical anthrax-like lesions. So we try to culture that, but it's anaerobic. Anyway, we are very sure it's an anaerobic condition. So a culture was very difficult because in the anaerobic situation, there are a lot of other anaerobes flares up and which will prevent, you cannot come into any kind of conclusions. So we applied whole genome sequencing, okay, bacterial metagenome sequencing, maybe the first time in free-ranging wildlife. So we use the Illumina platform to identify V3, V4 regions, amplify using specific primers. And when we did that, we got a huge bunch of cases and coming into this taxonomic group. Okay, Clostridium novae type B. Okay, then we develop Sanger specific sequences. Okay, we'll come to that. This is our NGS metagenome data. Then we validated with our 16S ribosomal RNA gene data of Clostridium novae, which is quite same. Then we use flagellin genes specific to Clostridium novae type B to type it, and it was very clear. So molecular findings are taxonomy annotation based upon 16S RNA, and Illumina data that is metagenome data, bacterial metagenome data are very similar to the phylum Firmicutes and Clostridium novae. Then species level Clostridium novae was commonly present among all the samples, and the Shannon index rank, it was high. And further, Sanger validation due to 16S and also flagellin gene also confirmed Clostridium novae type B. Okay, Clostridium novae is quite important. It's very rarely described in wild animals, mainly in sheep. It's described black disease, except some cases in reindeers and bighorn sheep in Canada. Okay, so it's a truly emerging. Now every summer we are getting cases. Okay, it's again fluctuating as well. So There are other cases also. This is a quite interesting case, around 6 cases. Dr. Kalivanan got a couple of cases. This is a systemic mycosis. Okay, just like look at the liver on the left bottom panel. You can find TB-like lesions, but the whole liver is filled with fungal mycosis. Okay, so this is a systemic mycosis, which quite rare. You can find the typical vulval lesions also, and could be attributed to the host immunity. Okay, systemic mycosis is very rare in a natural population, except some like patients, just like immunocompromised patients. In the humans, you are getting a lot of cases. So this is something we can looking into buccal and vulval mucous membrane examination. It can give any clues in immune status, because the galt and malt gut-associated lymphoid tissues and mucus-associated lymphoid tissues, which is very important in elephants' immunology. So they are first defense of innate immunity, and which can give kind of we are arguing kind of status of immune status. So thank you very much. So thanks a lot.
Thank you, Dr. Arun, for the wonderful presentation. It was very, very informative.
Sorry, I took more time. I'm really sorry.
No, that's fine. That's fine. No problem. Yeah, you have a few questions also, maybe 1 or 2 questions.
Yes.
Sir, can you brief and throw some light on herpes vaccination, please? Name is not given.
There is a new vaccine. There is a new vaccine developed. Okay. The group from Netherlands, they developed a vaccine, and the efficacy under tests, and I think it will coming out. It is under the process. I think it's under the process. So subunit vaccine. Okay. So there is a development of chance of vaccine is really promising.
Dr. Bhaskar has a question. Do you think rate of alteration of environment by anthropogenic factors also evoking some adaptations in the population of elephants? Further, smaller and fragmented populations will be more affected with such alterations. Are we seeing, a few more things. Are we seeing more disease in small and fragmented populations than in large populations in well-connected habitats? These are the questions.
Okay. Of course, yes. The question for the first one, that is large population versus small populations. So meta-populations, I would say, is if it is due to human reasons, anthropogenic reasons, or natural reasons, which the meta-population problem is that actually it increases the contact area. Okay. When a large population, there is a large landscape, the chance of interaction with human to wildlife or interface is less. Okay, that is one, the spatial parameter. Second one, the genetic parameters. In a small population, the genetic fitness goes down. There is a high chance of inbreeding. As I told you, it's a female selection. So there is a less chance of selection process. And the genetic fitness of the population may decrease, which can impair, which can make this animal, okay, this again a hypothesis based, but there are a lot of evidence coming up, causes the emergence of diseases. Yes. And the third question is, I'm sorry.
Are we seeing more disease in small and fragmented populations than
yes,
large populations in well-connected habitats?
Yes. The problem with that, when there's a large population, of course, the number is more. Okay, so incidence number is more. Okay, the frequency of disease is more. Okay, in a small population, so based upon the population size only, you can epidemiologically only you can say. Okay, so cases divided by the population size. Okay, so there are problems. There are new new recruits, just like birth. You have to look into natality and mortality, and coming into a population size. I would say an effective population size genetically, and then you have to correlate with that to the mortality. Then only you can come into that. Yes, that gives some indication that fragmented small populations, there is a high chance for diseases.
Okay. There is one more question from Mohammad Firdaus. He says, insightful presentation, Dr. Arun. I would like to ask, with regards to the systemic mycosis. What fungi was cultured from the case? Is it sporotrichosis or mucus? Yeah.
It's a sporotrichosis, actually. We didn't culture that. We did a PCR. Okay, it's a sporotrichosis, all the cases. So which is quite bizarre for us. Okay, so first we did the histopathology, we got this thing, and we did the PCR. So yeah, it's quite bizarre, and I think it's emerging conditions. We need more studies on that.
Okay. Yeah, thank you. Dr. Ganga from Sri Lanka has a question. Is it legal to euthanize critically ill wild elephants in India?
No. But we are trying to, change the laws. Just like if fractures or other cases, and we better to do the euthanasia rather than animal is suffering. So, but it is not legal. You can do that actually if the chief wildlife warden permits. Okay, the head of the forest department permits. We can do that most of the time. Yes, it's legal. Sorry, it's legal. It's legal, but it's not under the purview of a veterinarian. Okay, the domestic animals is under the purview of veterinarian, but in states, the chief wildlife. Sorry.
No, nothing. It's an auto message. Yeah.
Okay.
Yeah,
Okay. So so it's basically legal, chief wildlife warden, but it's not under the purview of a veterinarian. So we want to change that. We want to make it more flexible, right?
Okay. Yeah. There is one question from Punika. Thank you for the interesting presentation. Did you find the incidence of hemorrhagic septicemia?
Not much, which is quite an interesting question. Not much. We have seen so many papers talking about hemorrhagic septicemia, but there are a couple of references from captive elephants, hemorrhagic septicemia, but not in the wild. We are extensively looking into hemorrhagic septicemia, but not in the wild.
Yeah. More questions may come. Thank you so much, Dr. Arun. Over to Dr. Heidi. Yeah.
Okay, thank you very much, Arun.
Thank you, Heidi.
Really appreciate your presentation.
Thank you.
Very interesting. So